Today, this is a special press conference, and the main purpose today is to give people of Ohio a better understanding as this fast runaway freight train of this virus is spreading around Ohio. But to give people of Ohio a better understanding of what's going on in our hospitals. I started my morning this morning, a 6:30 call with the hospital zone leads around the state. And I really feel that's important that what they told me this morning that they share directly with the people of Ohio. So we're going to go in a moment to them, and they're going to be the ones who will answer the questions. They'll be the ones who tell us exactly where we are in regard to our hospitals. We had more good news today on the vaccine front. We learned this morning that AstraZeneca's vaccine is up to 90% effective. This comes on the heels of recent news of Pfizer and Moderna being about 95% effective. That is just great news. Later this afternoon, I will be on a call with other governors in regard to the federal officials who are going to talk to us more about the distribution of the vaccine. So we are, again, very, very excited about that. It is coming. The rescue is on the way, and we're very excited about that. Let's go to our cases for today. Today, we're reporting 11,885 cases. We are also reporting an additional 282 Ohioans have been hospitalized because of COVID. Sadly, we are reporting 24 Ohioans who have died. So this is the data from today. Now, there has to be an asterisk by this, and let me take a moment to explain it. The big picture is that the high volume of these cases is now overwhelming the system. It's not only overwhelming the Ohio Department of Health system, but it's also causing some problems in regard to the laboratories and getting all this information through. So there's two things going on. And once I explain it, you're not going to know exactly what the number is. But the number is high. And this number has been averaging about 8,500 cases per day. This particular jump is caused, at least in part, and maybe wholly, by something that happened 2 days back. And that is two laboratories that we're reporting in, two of our bigger labs. That reporting did not go in for 2 days. And so this is 2 days worth of those two labs added to this. And so is Mercy Health and the Cleveland Clinic. So both of these are big systems. And so this is what results in this particular number, 11,885. So it may be artificially high, but it has that involved in it. We still have the problem we talked to you about the other day, which is antigen testing. There's now about 15,000 of these backed up. We estimate, and that's an estimate, about 3/4 of those will ultimately be cleared in because many of those, or a good number of those, are antibody. They come together in the system. Again, the point is that we are at a very high, certainly a very historically high level, and we hope in the matter of the next few days to get all this cleared out so we can give you the exact numbers each and every day. Today, though, is about hospitals, and I think that if you really want to see exactly what's happening in Ohio, the best way to do it is look at the hospitals because these are numbers. This is a count. The number we report is what the hospitals report to us all throughout the state of Ohio of what their COVID count is in every single day. At the press conference on Thursday, I know that we had more than 3,800 COVID patients that were in the hospital at that time. It was then the highest patient count we'd seen throughout the 8 months of the pandemic. Unfortunately, the number has continued to go up. The Ohio Hospital Association is reporting that we are at 4,358 patients as of today. 4,358. This is a 59% increase from just 2 weeks ago. We also currently have 1,079 patients who are in the intensive care unit, which is again far higher than we have seen so far during this pandemic. And if you look at the chart again, which is the blue is the number of people hospitalized from COVID. There is the number, and this is the ICU. The ICU is obviously trending up as well. So this has been a dramatic change. If you go back September 1, August 31st right here, and you can just see the dramatic change. And even down here as late as September 25th, we were still around here, and we've seen what's happened.